So the increases that have occurred with antibiotic-resistant sexually transmitted infections are concerning. And truthfully, it's probably not a surprising answer that the best way of preventing them is through contraception, through barrier protection. But the increase in resistance is something we've seen with one antibiotic and then the next one and then the next one, and this just keeps continuing to now we're at the point where gonorrhea, for example, is not treated orally, it's treated with an IM medication, and we're seeing resistance to that. So truthfully, obviously abstinence works very well, but barrier forms of contraception are the most important way of preventing sexually transmitted infections and the resistance that occurs with them. So when I'm talking to pharmacists about how to counsel patients on antibiotic-resistant sexually transmitted infections, I think we just have to be candid and honest with the patient. Some sexually transmitted diseases, most particularly gonorrhea, are very, very efficiently spread through ways that are rather obvious. But what I mean is per encounter, the likelihood of spreading is rather high. So patients should be told that, and the resistance is only going in one direction. It's going up, and it's becoming harder and harder to treat. So I think all we can do is be candid and just kind of tell it like it is. Chances are very good they'll be effectively treated by an anti-infective, but those chances were better a year ago and a year before that and so forth. So every time that one of these infections is spread and antibiotics are used, the likelihood of resistance for that infection, certainly for the next one, is higher.